Hi there, this is Dr. Robert Fichetti. I wanted to give an update on Huntington's disease modifying therapies. I don't have any commercial interests in the companies being mentioned. So let's begin with Uniqure, or which has the AMT-130 product. So this is a investigational adenovirus therapy coupled with a inhibitory microRNA for the huntingtin protein, both wild type and mutant. They reported 24-month interim data which showed a cUHDRS worsening that's much less than that in a control group, which I believe is likely the EnrollHD data. They had a reduction of 0.2 or minus 0.2 on cUHDRS versus minus 1.0. This therapy requires a brain surgery to actually selectively deliver the AMT-130 to the basal ganglia, which are involved in Huntington's disease. Comparatively, PTC Therapeutics has PTC-518, which is showing a 60% reduction in mutant huntingtin mRNA and 35% reduction in huntingtin protein in the Pivot HD trial. And again, their product is specific for the mutated or mutant huntingtin RNA. They are reporting a decrease in cUHDRS, but only as a trend, and this is only at 12 months, so it's more difficult to compare that to the 24-month data for AMT-130. Wave Life Sciences has a mutant huntingtin selective or allele selective antisense oligonucleotide, which shows 44 to 46% reduction of the mutant huntingtin protein in the cerebrospinal fluid. There's also Skyhawk, which has Sky 8515, which is an oral also splicing modulator or splicing inhibitor. Volunteers in phase 1 and phase 2 studies showed a huntingtin mRNA decrease of 72% on their multiple dose trial, MAD, which included the 9 milligram dose. And just wanted to also mention the Ionis HTTRX or tominersen, which initially showed very promising data, also was supported by Roche Pharmaceuticals, eventually did not meet disease-lowering standards, and the tominersen studies were stopped. There's also the earlier trials on allele selective ASOs, and in particular two of the earlier Wave Life Sciences ASOs were discontinued because in the clinical trials they did not show the reduction in huntingtin protein as we had expected. So I'm going to look at what further trials show and try to stay as updated as possible on the possibilities in Huntington's disease. Thank you very much.